Good afternoon, class. How are you today? Today's lesson is going to be all about skin analysis. Upon completion of this lesson, you should be able to know what type of skin your client has out of the 5 skin types. You should be able to identify skin condition and disorders that your client's skin may have. You should be able to perform a proper skin analysis using the equipment, mainly your Woods lamp and your mag lamp. Your Woods lamp and your mag lamp we actually learned how to use yesterday, so you will be able to implement those today in doing your skin analysis. The supplies and products and equipment that you need are obviously your facial bed. You're going to need your magnifying lamp and your Woods lamp on your 15-in-1 machine. You're going to have your bed properly draped. You're going to have some towels, a headband or head covering, gloves, wrap, 4x4s or cotton rounds, toner, and hand sanitizer. You're going to learn about 2 different aspects of a skin analysis today: skin condition and skin type. There are 5 skin types. You have normal, dry, oily, combination, and mature and aging. And the 4 skin conditions that we are going to talk about today are dehydrated skin, cuperous skin, rosacea, and acneic skin. Prior to me starting this lesson, I passed out 2 sheets of paper. The first one is a skin client analysis evaluation form. They're called different things, could be part of a consultation form, not necessarily. This is something that you need to make sure that you are documenting on for your client for every single treatment. They'll have their name, their phone number, the date that you are performing the skin analysis. You will write down what your findings are, what skin type you have typed your client's skin, any conditions that your client may have or disorders that your client may have. You want to make sure that you document those. You also want to make sure that you, after performing your skin analysis, you document what your treatment plan is going to be. What products are you going to use on your client during this treatment? What are the follow-up products for your client to use in an at-home regime? And what products that you recommend using for your client's skin condition and skin type. You want to make sure that you break those down in the daytime and nighttime for your client. The other paper that I passed out is a mind mapping. In the middle is skin. Around the outside, we have different internal and external factors, which is intrinsic and extrinsic factors that can affect your client's skin types and conditions. They're mixed up on here, and there's different ones. You've got age, stress, incorrect products or using products incorrectly, genetics, water intake, living and working conditions, smoking and alcohol intake, medication, illness, poor nutrition, and hormones. All of these can affect your client's skin conditions. Your prior assignment was to familiarize yourself with the consultation form. The consultation form and the skin analysis form sometimes are the same, but should be different. The consultation form has all the information that your client fills out: their name, address, what products they use at home, what medications are they on, do they have any allergies. Your skin analysis form is the one that you as an esthetician fills out to let you know what is your plan of action, what are your findings, and what is your next step. Let's get back to skin type and skin conditions. There are 5 skin types, as I said. The first one that we're going to talk about is normal. A normal skin type has sufficient moisture. A dry skin lacks sebum. Sebum is another name for oil, lacks sebum production. An oily skin has excess sebum production. And a combination skin is both usually normal and dry or oily and dry. It can be 2 different skin types from this list. When it's combination, it usually means that they are one skin type in the T-zone, which is from the chin to the forehead and from ear to ear, and a different skin type in the other 4 quadrants. Doing a proper skin analysis will help you determine that. A mature and aging skin usually has loose skin, sagging skin, crepe-like skin. It could be thin. It could lack elasticity and firmness. Skin conditions that we're going to talk about are the dehydrated skin, cuperose skin, rosacea, and acneic skin. Dehydrated skin is lack of moisture. That is different from dry skin. Dry skin is lack of oil production, sebum production. Dehydrated skin is lack of moisture. Cuperose skin is when a client has fine lines, broken capillaries underneath, just under the surface of the skin, usually around the nose and in the cheek area. A rosacea skin is flushed skin. It's always flushed. They'll have sometimes in their cheek area, on their chin. It could be in their décolleté. Could even be on their ears. And then, of course, an acneic skin. Oh, and also forgot to say that rosacea skin is aggravated by alcohol, stress, spicy foods, and extreme temperatures. Then we come to acneic skin. That is an overactive sebaceous glands on the skin, which can cause pustules, open and closed comedones. So, and we have talked about all of these conditions prior to this lesson. The steps involved in doing a skin analysis is you want to make sure that your client is secure on the table and they're properly dressed. You want to make sure that their hair is pulled back. You want to make sure that you have clean, dry hands. You want to make sure that you have covered your client's eyes with cotton rounds or a 4x4 in the butterfly position or one on each eye. You can moisten those. I would highly suggest it. Moisten them with toner or water, wring them out really well, and place them on the eye. It helps them to, it weighs them down so that they stay on the eye better. Remember, when you're removing the 4x4 butterfly or cotton rounds, that you're doing it in a downward motion towards the chin and then out. You don't want to go up. That will help make sure that you are not getting product in the client's eyes. You make sure you want to follow that for safety reasons. You also want to make sure that you're doing this in a methodical way. You're looking at the client's face. If you get in the habit of doing this the same way with every client, then you will not miss a spot on the client's face. If you start with the chin, then go to the eyes, the forehead, the nose, the mouth, and then the entire face as a whole. You want to make sure that you are looking for clogged pores, hyper and hypopigmentation, age spots, freckles or moles. And if they have freckles or moles, where are they located? What color are they, and what are their size? Is there any puffiness around the eyes or on the face in general? How is the elasticity on the face? Check for firmness. You're also checking texture. You want to make sure that you're feeling the client's skin. You're touching the client, looking for all of these things and documenting them as you go or when you get done. For For safety reasons, you want to make sure that your client is secure on the bed. You want to make sure that you're choosing the effective products for your client's correct skin type and skin condition. You want to make sure that when you remove the client's butterfly 4x4 or cotton rounds from the eyes, that you are doing it in a downward and outward motion so that you do not get product in the client's eyes. You want to make sure that you follow all safety guidelines from state board, all infection control procedures, and any blood spill on yourself or your client. You want to make sure that you address those within the proper state board guidelines. You do know that if something like that happens, that you stop the service, you address it immediately. Say you drop the cotton round, you stop the service, you address it immediately, pick it up, put it in the waste basket. Make sure you wash your hands and sanitize your hands before returning to your client. In summary today, we have learned the different skin conditions, the 5 different types of skin. We've learned the equipment that you'll be using during your skin analysis. We also learned that performing a proper skin analysis and knowing the steps and using the equipment involved enables you to choose the effective products and treatments for your client's skin. Your follow-up assignment is to look on page 333 of your textbook, pick one of the skin conditions and characteristics on that page, right-hand column. I want you to find a picture of that, and I want you to bring it to class on Tuesday for discussion. Do a little research, write a little one paragraph about what that skin condition is, what are some treatments available that are good for that particular skin condition or characteristic. We will follow up this assignment with an assessment rubric on Tuesday. Today, after this lesson, when we get into clinic, we will be performing skin analysis and practicing skin analysis on each other. I would like for you to pick 2 classmates, do 2 different skin analysis so that you have something to compare to. Make sure that you pull their client consultation form and that you are documenting everything that you see. And we will discuss that on Tuesday. Right now, I have a few questions that I'd like to ask about the lesson. Mary, what is sebum? What does the word sebum mean? No, that's not quite right. Sebum is not water. Sebum is oil. This is something that you need to know. So be sure that you follow up with learning about that. The next question that I have is, what color does dehydrated skin show up under a Woods lamp? We went over yesterday the Woods lamp, the different colors. We also went over using the mag lamp. So what color did we find out yesterday that dehydrated skin shows up as? Mary, that's correct, violet. Very nice. The last question I would like to ask is, what light does a Woods lamp use? What is the name or spectrum of the light that the wood lamps use? Peter? Yes, that's correct, an ultraviolet light. Very good. Be sure that you are using your Woods lamp today in clinic and that you are familiarizing yourself further with the different colors that you see under the Woods lamp. If you have any questions, be sure to come to me so that I can help you. I would like to thank you for coming to our class today, and I hope you have a good day. Thank you.